Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about tension headaches. You're going to learn simple memory tricks and mnemonics to remember the symptoms, causes, treatment, and more. And by the end of this video, you'll know all of the key concepts. This is great for nursing, EMTs, and med students, so make sure to turn on the captions and watch to the end. You can also turn to the headache page in our Teach Me Medicine book and follow along. If you don't have your book yet, it'll be linked down below. It's full of simple explanations to save you time. So what is a tension headache? A tension headache is a type of primary headache that causes a dull pressure squeezing pain in the head. The easiest way to think about it is it often feels like there's a tight band pressing or squeezing around your head. The other names for tension headaches include tension type headache, stress headache, or muscle contraction headache. And this is important for your exams. Tension headaches are the most common type of primary headache. As a reminder, primary headaches are headaches not caused by an underlying medical problem or condition. For example, it's not caused by a brain tumor, infection, or a stroke, to name a few. Other examples of primary headaches would be migraines and cluster headaches. Now remember we said tension headaches can feel like a tight band pressing or squeezing around your head, so it creates a band-like pattern. And this brings us to our first memory trick. You can use the word band to remember the symptoms of a tension headache. First of all, the word band will help you remember tension headaches are a band-like pattern. Then the letter B in band will help you remember bilateral. The A stands for aching, an average of 4 to 6 hours. The N stands for neck tightness, and nocturnal or nighttime. The D stands for dull. You can also add an S to make it bands, and the S will help you remember squeezing. So starting with B, this will help you remember bilateral. Tension headaches are typically bilateral, which means it affects both sides of your head. The A will help you remember aching. Tension headaches are typically a dull, aching pressure pain. The pain is usually mild to moderate and less commonly severe. The A will also help you remember average of 4 to 6 hours. The duration of tension headaches can be anywhere from 30 minutes to 7 days, but the average duration is 4 to 6 hours. And tension headaches can often be recurrent. The N will help you remember neck tightness. Tension headaches can cause shoulder muscle and neck tightness, and we're going to see shortly that stress and muscle contractions in the head and neck can also cause tension headaches. You can also use the N to remember nocturnal or nighttime. Tension headaches can worsen at night, and this can be due to stress from the day, clenching the teeth at night, or sleeping in an awkward position. The D will help you remember dull. We mentioned before tension headaches typically cause a dull pressure pain. Finally, if you add the S, this can help you remember squeezing. Again, tension headaches typically cause a dull squeezing pain. And then remember the mnemonic band will help you remember that tension headaches are typically a band-like pattern around the head. So we can see how this mnemonic helps us remember the symptoms of tension headaches, including the pain, the location, the intensity, and the duration. Now that you know the symptoms of tension headaches, let's jump right into the next memory trick. You're going to use the word tension, which is simple to remember for tension headache, and this will help you remember everything else. The T stands for 20s or 30s. This will help you remember the age of onset for tension headaches is typically 20s and 30s. The E stands for estrogen. This will help you remember tension headaches are more common in women than men, and fluctuations in estrogen levels may play a part in headaches in general. The N stands for number 1. This will help you remember tension headaches are the most common primary headache. The S stands for stress. This will help you remember stress is the most common trigger of tension headaches. The S can also stand for strain. This will help you remember eye strain, and muscle tension in the head and neck can also lead to tension headaches. The I stands for intoxication. This will help you remember alcohol is another potential trigger of tension headaches. I can also be used to remember eye strain. You can use the letter I to remember the word I. The O stands for over-the-counter, and this will help you remember over-the-counter medications like NSAIDs and acetaminophen can help treat tension headaches. The N stands for non-pharmacological, and this will help you remember non-pharmacological treatments. We'll talk about how to relieve tension headaches shortly, but the other cool part about this memory trick is you can break up the word into categories. So the T, E, N all describe the epidemiology of tension headaches. The S and I describe causes or triggers of tension headaches, and the O and N describe treatment options for tension headaches. So not only does the word tension help you remember tension headaches, but you can also break down the word into its categories. Starting with TEN, this was the epidemiology of tension headaches. We have the T, which stood for 20s and 30s. The age of onset for tension headaches is typically in your 20s and 30s, but can also be in other age groups. And this is thought to be due to a number of factors in this age group. There's typically increased stress from new careers, financial burden, relationships, and family life, to name a few. This age group may also experience poor posture, poor lifestyle habits, sleep deprivation, excessive caffeine use or withdrawal, and alcohol use, to name a few. And this makes sense because we'll see most of these factors are also triggers or risk factors for tension headaches. Moving on to E, this stood for estrogen. Tension headaches are more common in women than men, and this is thought to be due to fluctuations in hormone levels, especially estrogen, among other possible factors. Finally, the N stood for number 1. This is because tension headaches are the number 1 most common cause of primary headaches. So remember, tension headaches are common in your 20s and 30s, are more common in women, and they're the most common type of primary headache. So what causes a tension headache? This was the S and the I in the mnemonic tension. The exact cause and pathophysiology of tension headaches is not fully understood, but there are triggers and risk factors for tension headaches. The first is the S, which stood for stress and strain. Stress is the most common trigger of tension headaches, and this can be emotional or physical stress. Eye strain and muscle tension to the head and neck can also trigger tension headaches. Moving on to I, this stood for intoxication. Alcohol can potentially trigger tension headaches. And again, you can use the letter I to remember the word I for eye strain as well. Other potential triggers or risk factors for tension headaches include poor posture or position, and this could be sitting at a desk or computer for long periods of time, jaw clenching, caffeine intake or withdrawal, dehydration, and sleep deprivation. And again, we can see how these triggers potentially correlate to the lifestyle of someone in their 20s and 30s. As we mentioned earlier, tension headaches are common in your 20s and 30s, so this makes sense. How do you treat tension headaches or relieve them? This was the O and the N in the mnemonic tension. We can split the treatment into pharmacological and non-pharmacological. First, we have the O, which stood for over-the-counter. Over-the-counter medications like NSAIDs and acetaminophen are typically the first line for tension headaches, especially for episodic ones. If the tension headaches are more chronic or there's also migraines, then triptans or amitriptyline may also be considered. Then we have the N, which stood for non-pharmacological. There are non-pharmacological treatment options as well. This may include relaxation techniques, exercise, stress reduction, and improvement in posture. Physical or cognitive behavioral therapy may also be considered. How do you diagnose tension headaches? The International Headache Society has diagnostic criteria for tension headaches, and they include at least 10 episodes of headaches fulfilling criteria B to D. B is the headaches last from 30 minutes to 7 days. C is the headaches have at least 2 of the following 4 characteristics, which include bilateral location, pressing or tightening quality, mild to moderate intensity, and not exacerbated by routine physical activity. D is the headaches have both of the following, which include no nausea or vomiting, and no more than one of either photophobia or phonophobia. Finally, the headaches cannot be better explained by another diagnosis. If this criteria is met, and there are no red flag headache symptoms, which we'll talk about shortly, and there are no concerning physical exam findings, then labs and imaging may not be necessary, and a diagnosis of tension headaches can be considered. However, if the criteria is not met, or there are red flag symptoms, or there are abnormal exam findings or any other concerns or reasons, then more of a workup may be necessary, and this could include a CT head, MRI brain, lumbar puncture, or blood work to name a few. And this is typically done to make sure there's not a secondary headache, which is a headache caused by something else. An underlying medical condition is causing the headache, and this could be infection, trauma, or tumors to name a few. So what are these red flag headache symptoms to look out for? You can use the mnemonic Snoop 10 to remember them. This mnemonic was published by the International Headache Society, and it's the criteria that increase the likelihood of a secondary cause to a headache. The S stands for systemic symptoms, including fever. The N stands for neoplasm history. The other N stands for neurologic deficits, including decreased consciousness. The O stands for onset that is abrupt or sudden. The other O stands for older age, with onset after 65 years old. The 10 P's stand for pattern change or recent onset of new headache, positional headache, precipitated by sneezing, coughing, or exercise, papilledema, progressive headache and atypical presentations, pregnancy, painful eye with autonomic features, post-traumatic onset of headache, pathology of the immune system, and painkiller overuse or new drug at the onset of headache. Any of the SNOOP 10 criteria may indicate a secondary headache and may require further workup such as imaging, lab tests, or lumbar puncture to name a few. If a diagnosis of tension headache is made, it can be classified into 3 different types. The first is infrequent episodic, which is headaches less than 1 day a month or less than 12 days per year. The second is frequent episodic, which is headaches 1 to 14 days a month for over 3 months or 12 to 180 days per year. The third is chronic, which is headaches 15 or more days per month for over 3 months or more than 180 days per year. Now let's recap what's important to know for your exams. Tension headaches are the most common type of primary headache. The age of onset is usually in your 20s or 30s. Tension headaches are more common in women. Stress is the most common trigger. The headache is typically bilateral in a band-like pattern. It's often described as pressure or squeezing. Treatment may include NSAIDs and acetaminophen as first-line medications, and treatment may also include relaxation, posture improvement, and exercise, to name a few. Remember the mnemonic BAND to help you remember the symptoms and clinical features of tension headaches, and then the word BAND will help you remember the headache is a band-like pattern. And also remember the mnemonic tension to help you remember the epidemiology, triggers, and treatment of tension headaches. So an example test question about tension headaches may be a 28-year-old female presents with a 3-day headache. She describes the headache as feeling like a tight band around her head. The headache is on both sides. She reports being under increased stress since being promoted as a manager at work. She sits at her desk, staring at the computer for long hours. There is no nausea, no vomiting, or history of trauma. There are no other concerning red flag signs or symptoms. Tension headaches should be in your differential. The clues are underlined and they include 28 years old, a female, 3 days of symptoms, tight band around her head involving both sides, increased stress, potential poor posture, and no other red flag signs or symptoms. There may be other diagnoses possible, but tension headaches should be considered. Hopefully this helped you understand tension headaches. Please hit that like button and leave a comment. Subscribe to save time studying and not miss out on future videos and notes. You can find all of our flashcards, notes for the videos, and book linked down below. Thanks for watching and hope you return for future videos.